Hello everyone, welcome to the part 2 of COVID-19 management in adults. We are checking the revised guidelines in COVID-19. My name is Dr. Rohit Herekar. We have used national guidelines now released on the 14th January and state guidelines which are released on the 5th January. In first part, we have seen that those with mild symptoms with or without comorbidity usually don't require any laboratory or radiological workup. In some cases like diabetics, you can check only blood sugar and no other workup. Organ damages like heart, kidney, liver, lung or malignancy, some baseline workup might be indicated. The various comorbid conditions associated with worsening are shown here. Now, in any of the mild cases, if they develop breathlessness, then you have to be on alert. A persistent fever lasting more than 3 days, or any pressure or discomfort in the chest, relapse of symptoms like patient was doing well on paracetamol and suddenly he feels weakness or increased fever or myalgia, you have to be careful. Someone developing altered consciousness, and of course SpO2 less than 94 picked up on walk test or otherwise. Especially for those with comorbidities, keep a low threshold for above symptoms, and if any of the above symptoms develop, you need to do the full workup as well as HRCT chest on 5th day of illness or on admission day. Now let's see the management of moderate COVID-19. In moderate COVID-19, the virus has entered lung and now multiplying in the alveoli. We have seen in first and second wave, Delta being more aggressive one. This is a typical stage of pneumonia starting after 5 days. Now what we are seeing in the wave of Omicron is the virus having a tropism for tracheobronchial tree. Majority cases, it will be localized to upper respiratory tract. Few, especially those with comorbidities, it will multiply in the tracheobronchial tree rather than alveoli, and hence we are seeing exacerbation of underlying comorbidities like COPD, heart failure, then pneumonia. However, as a clinician, we never know whether it is a Delta or Omicron. Now, moderate COVID-19 is defined as if any one of the following is present: on room air SpO2 between 90 to 93% or respiratory rate more than 24 up to 30 breaths per minute. In laboratory workup, baseline investigations like complete blood count, liver and kidney functions, blood sugar and ECG, inflammatory markers, CRP, LDH, D-dimer and ferritin. These inflammatory markers are non-specific for COVID. They have some prognostic value. Only CRP has some therapeutic value. Suppose a moderate COVID-19 is improving and his inflammatory markers are high, no need to worry about them. Also, as per national guidelines, you can repeat lab if deteriorating 48 to 72 hours. There only CRP and D-dimer repetition may be enough. Other lab workup done as per severity. Fibrinogen recommended in state guidelines, not in national. Elevated in severe COVID, non-specific. TROP-I or CKMB as per patient. These are elevated in severe COVID, myocardial inflammation or ischemia. Sometimes HIV, H-base, AG, HCV done to determine underlying immunosuppression. HbA1c and daily BSL monitoring is needed in all diabetic cases. Other tests we'll discuss in severe COVID-19. In radiological workup, we follow the Maharashtra State Task Force guidelines, which are little more aggressive than national. Baseline chest radiograph on admission and a HRCT chest plain on 5th day of illness or on admission day. Repeat CT scans should be avoided in moderate COVID-19 if patient is stable or improving. Serial chest radiographs may be done to check the new onset infiltrates or worsening. Only in unexplained worsening you can do a CT chest. Now regarding drug management, not much changes have occurred. The first drug is oxygen. Now oxygen should be treated as a drug. Now patient is hypoxic between 90 to 93. So we are going to give him oxygen just to keep the SpO2 above 94. Various modes like prongs, mask, NRBM, as per severity and as per FiO2 requirement, we will use them. In COPD, however, target around 90%, even 88 to 92% will be enough. We encourage to do the COVID awake repositioning protocol, changing position every 2 hourly. Awake proning for more time is also suggested. Now next drug is injection remdesivir we have used in the first and second wave. The problem in Delta wave was the patients were getting admitted really late beyond day 10 with severe hypoxemia where remdesivir doesn't work. Day 1 200 mg we use in 200 ml NS over 1.5 hour followed by 30 ml NS flush. Next subsequent in 100 ml NS over 1 hour followed by NS flush. Severe kidney disease, liver disease, non-hospitalized, pregnancy, lactation and those on invasive ventilation or more than 10 days are some contraindications for using the drug. Adverse effects like bradycardia, nausea, elevated SGOT-PT, if more than 5 times above, you have to stop. Rarely hypersensitivity. Also, we use a separate IV line every time we administer remdesivir. Next are steroids, which have a mortality benefit in moderate COVID-19. National guidelines recommend methylprednisolone 0.5 to 1 mg per kg BD for 5 to 10 days. And state task force guidelines recommend dexamethasone OD. A switch to oral steroids at equivalent dose can be done if patient is stable or improving. Steroids need not be given to full 10 days. They can be stopped in moderate COVID-19 if patient is off oxygen. Next is anticoagulation. We use enoxaparin as per state and national guidelines. Prophylactic dose 0.5 mg per kg subcut OD. In moderate COVID-19, there are very less chances of pulmonary embolism unless clinically suspected. So prophylactic dose will be enough. Contraindicated in bleeding tendencies. Chances of secondary bacterial infection are less in moderate COVID-19. Only Maharashtra guidelines recommend antibiotics, that too very judiciously. To summarize, moderate COVID-19 is SpO2 90 to 93% and respiratory rate 24 to 30. Clinical monitoring and SpO2 monitoring is of paramount importance. Lab and radiological workup should be done only if there is a clinical worsening and more dependence on clinical severity rather than lab and radiological. Treatment of oxygen, remdesivir, steroid and heparin remains the same. Next coming weeks we will come to know whether Omicron causes more pneumonia or exacerbation of underlying factors. Thank you very much for watching the video.